शङ्खं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनं मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम्
Very good evening to one and all. I welcome Dr. Bhairav Kulkarni Taushikar sir on behalf of Ayush Darpan team. Today is World AIDS Day and we are celebrating this day with a renowned speaker, Dr. Kulkarni sir. Sir is professor in the Department of Kaya Chikitsa in Ved Prakash Patil Ayurvedic College, Maharashtra, India. And so it's really a proud moment here to celebrate this World AIDS Day. Every year, this 1 December is celebrated as a AIDS Awareness Day. And this day is celebrated since the year 1988. So, and it is organized by Ayush Darpan Foundation Trust, Dehradun, India. So I welcome Dr. Kulkarni sir on behalf of our team. And sir, this forum is open for you. Yes, please. And sir is renowned international speaker and sir delivered many talks on everywhere. And I think tomorrow sir is going to attend the Global Ayurveda Festival in Kerala. So it's really a pride moment for us to be with sir. So please, sir, you can continue your speech.
Yes. First of all, thank you, Dr. Shilpa Erme, madam, and thank you, team Ayush Darpan, who invited me as a guest speaker in on the occasion of AIDS World AIDS Day on the 1st December. So, welcome you all. Some people will join soon. So, without wasting a time, madam, it's a recorded session.
Yes, sir, I will record it. If you say, I will record it. It's live on Facebook of Ayush Darpan. Yeah, if you want, I will record it. No issue.
Please record it.
Yeah. Yes, I have started the recording and it's live on Facebook of Ayush Darpan. I will share the link with you all.
Okay. Thank you.
Yeah.
Thank you. First of all, today it's a 1st December. So, you all know many people spotting a red ribbon today. So, it is the universal symbol of awareness to support for those who are living a HIV. So, HIV means human immunodeficiency virus. As a people across the globe and who are commemorating World's AIDS Day. So it is important to know about the treatment of HIV. Once the some people figure out difference between HIV and AIDS, the next question that pops into their minds is the treatment. Okay, so surprisingly, none of the current treatment option or result in HIV cure, but viruses attempts have been made. So many people even look for the alternative treatments even through Ayurveda, and natural treatment don't have cure. So they seems to help in the relieving some type of symptoms of HIV infection, my dear friends. So according to National Health Services, it means NHS, HIV is a virus and it is responsible for damaging the cells in your particular immune system and weakening your ability to fight the diseases and everyday some infection also. So, my dear friends, here I tell you some key facts in a particular disease. So, HIV, it remains a major global public health issue, my dear friends. And it having a claim 40.4 million lives so far, ongoing transmission in all countries globally. So, with some countries reporting increases trends in new infection when previously on the particular declines. So, in 2022, some data, it's near about lots of people died from HIV related cause. So 1.3 million people acquired by HIV. So WHO, World Health Organization, the Global Fund and UNAIDS all have global HIV strategies that align with a SDG target 3.3 ending the HIV epidemic by 2030. So it's very difficult, my dear friend. So particular these type of diseases, we just overview of this disease. HIV, you know, human immunodeficiency virus is an infection that attacks your body, your immune systems, and acquired immunodeficiency syndrome, it means AIDS, is the most advanced stage of HIV disease. So HIV targets the body's white blood cells, weakening your immune system. This makes it easier to get sick and disease like a tuberculosis or any type of infection and some type of cancers also, my dear friends. So HIV is spread from body fluid of an infected person, including blood, breast milk, semen, and vaginal fluids. It is not spread by kisses, hugs, or sharing foods. It can also spread from a mother to her baby also. So HIV can be treated, preventing and antiviral therapy, it known as ART. So untreated HIV can progress to AIDS often many years, my dear friends. So we look about signs and symptoms of particular diseases. So what is the sign and symptoms? You all the doctors, medical students who are present here, you know, fever, then headache, a rash, sore throat are some symptoms in the first stages or first few weeks after being infected. People may not experience any symptoms, but some symptoms are there: fever, headache, rash, sore throat. After that, the infection progressively weakens their immune system. They can cause other signs and symptoms also. So there are swollen lymph nodes, severe weight loss, fever, diarrhea, and cough. So without treatment, people with HIV infection can also develop severe illness, my dear friends. So tuberculosis, TB. Then severe bacterial infections, cancers such as lymphomas and some Kapolis sarcoma also one of the sign and symptoms over there. So this is the particular sign and symptoms of the disease. So my dear friends, people who have recent high risk exposure and test is negative can be further test after 28 days. This is the particularly sign of this disease. So prevention is better than cure, my dear friend. So HIV is preventable disease. So reduce the risk with HIV infection, such as you can using male or female condom during sex. This is the first prevention. Being tested HIV and sexually transmitted infection. Having a voluntary medical male circumstances. Using harm reduction services for people who injected and use drugs. So all the doctors may suggested antiviral drugs, ARV drugs, including oral PrEP and long-acting products, injectable, long-acting cabotegravir. These are the some prevention method over there. So people taking antiviral therapy means ART and who have no evidence of virus in the blood will not pass HIV to their sexual partners. Access to testing ART is an important part preventing HIV, my dear friends. So this lecture, Dr. Yerme ma'am told me, sir, just tell about Ayurveda, role of Ayurveda in particular these type of infection or HIV diseases. So we are Ayurvedic people and we want to know prognosis, diagnosis and the treatment as per Ayurveda. Am I right, ma'am? So
yes, continue please with Ayurveda.
Yeah.
Ayurveda, yes, definitely.
Okay. So we are Ayurvedic people. So we just correlated with disease. We are not confirmed, but we just correlate. In Ayurvedic literature, we can find AIDS in the form of different Kshaya Avastha. So it namely Dhatu Kshaya, Dosha Kshaya, Oja Kshaya, along with vice versa. Or
sir, Hindi bhi chalega. If you are comfortable with Hindi, you can speak in Hindi too. It's better.
It is
as you wish. Yeah.
So in particular diseases, Vyapat conditions, not only it is more elaborating concept as a shosh also, my dear friends. So Dushi Visha, etc. Shosha, Dushi Visha, it compare that things also. But the disease revolves around the Oj only. So we can correlate with Ojakshaya. And AIDS management, clinically, it is a multi-system disease. So we can treat all the systems. Management of should be multi-factorial conditions and considering approach like a doshas, 3 doshas, 7 dhatus. Then Agni, Adhisthana, Strotasa, Nidana, Purvarupa, Rupa, Samprapti, etc. will considering the management of AIDS, my dear friends. We are Ayurveda people, so we need to consider these type of things, dosha, dhatu, then Purvarupa, Rupa, Samprapti. We keep in mind before the treat this type of infection or these type of diseases, my dear friends. So as per Ayurveda, first line of treatment to give symptomatic relief to the patient. Then next, improve their general condition. After that, to improve quality of health. And last one, rehabilitation. So we go through these 4 points. So what is symptomatic relief? So the main presenting symptom of AIDS are, already I told you, fever, then diarrhea, then weight loss, night swelling, malaise are the some infections, and it may be associated with tuberculosis, cancer, any type of bacteremia. So first to treat these type of symptoms, it is known as symptomatic relief, my dear friends. After that, to improve their general conditions, we concentrate their general conditions. The general condition can be improved by the Deha Bala, which mentioned in Ayurveda. Deha Bala, it means enhancing your immunity. Tattva Bala, moral support. Need to moral support. This type of patient need a moral support. And Agni Bala, to maintain their Agni Bala. So after that, to improve the quality of health of this type of patient, and how we maintain their quality of health. So it can be improved by counseling. You are the master. You are the Ayurveda doctor. So you are the master. So it can be possible to improve their counseling and education also. So education is a must. So imparting sex education, imparting knowledge of ahar, how to take and how to avoid. Follow the rules of Sadvrutta is the more better. Imparting knowledge of the disease. And then I focus on rehabilitation also, my dear friend. Include so in the particular disease, renewal of lifestyle of patient from morning to till night. It include in rehabilitation condition, it include environmental adaptation to remove their stress also. So my dear friends, HIV as a it takes almost 7 to 12 years to develop its symptoms. It is the mandatory code, keep in mind. In this period, we can plan to check their duplication of immunity so that infected person may live longer with or without minimum AIDS symptoms. And in the particular symptomatic relief, the infection are CNS probes. It related lots of like jwara, means we can known as a fever, jwara, fever, compare with a fever. So in case of jwara, Langana Chikitsa is there. And line of treatment, because of basic line of treatment is a Langan is mentioned in Ayurveda, Vagbhat Chikitsa Sthan, Adhyay 1. I give a reference also. Also, in Charak Chikitsa Sthan, 3rd Adhyay, it is mentioned. So, we have to switch over and Tarpana Chikitsa, like administration of Yavagu, Manda, Peya, Tarpana, then Ghrutapana after 6 days, and then mouse ras, any type of Kshirapaka, and Jwarahar Ghana, Jwarahar Yoga, we can prescribe or we can give that type of patient to control their Jwara symptoms. In Atisara, patient presenting the symptoms of diarrhea without a jwar, we should not pour purgatives, but should the him, we can prescribe them yavagu, peya, yusha, any type of kadhe. Then mausarasa. In case of purses, kshaya patient should be given mausa, and others atarpaniya methods with include administration. So gruta and bitter satvahari ahar we can prescribe. In symptoms of patient, they having some kasa symptoms or any type of cough. So in Charak Chikitsa Sthan Adhyay 18, it mentioned Deepanam Brahanam Chaiva. This is the shloka. So Charak, Acharya Charaka has quoted in Kshayaj. So it is mentioned Brahan. Ya Chikitsani. So it followed Agasti Haritaki, then Drakshadileha, Chitrakadileha, Padmakadileha, and Jivantyadileha, which regularly we use in the practices if some HIV patient is there. So regularly we use this type of medicines. This is very effective. Patient suffering from HIV and he having a symptoms of Kasa. So you already, you regularly use these type of medicines. Sanshodhana. So Panchakarma is very useful in these type of condition matter. Charak Sanhita, Chikitsa Sthan, Adhyay 8, Shlok number 41 to 42, it mentioned some type of treatments. So we can use or we can give these type of treatments, woman, saline water, or Madhu Kshayasti Kshira. Virechan we can give with the Haritaki, then Trifala Churna. We can give particularly Yoga Basti courses for these type of patient. Nasya, Snehana. After Snehan, we can give some Nasya treatment for these type of patient. After that, I want to talk on Rakta Mokshan. Rakta Mokshan is one of the type of Panchakarma. It should be applied only, seems necessary only in Rakta Pradoshaja Vikara, my dear friends. So in healthy individuals, the provocated doshas are purified in the prescribed season. It leadings when all the disease, and this can be tried in the asymptomatic AIDS condition only. So I already told you to improve their general condition, Dehabala. It is one of the major part to control their disease. Acharya Charak mentioned in a Charak Chikitsa Adhyay 3, Shlok number 41. You just refer the Shlok. Concept of immunity is centered around the concept of the Bala, which considered to basis of their health. So nachi sarvani sharirani Vedic shamatune samarthani vanti Vagbhat Sutrasthan Adhyay 21. It mentioned. So some people has ability to resist the disease, and one of the function of Bala is provided resistance against disease and bring back their Malsi diseases. Charak Chikitsa Sthan Adhyay 3 and Shlok number 167. You just refer over there. So one type opposes onset of the disease is called Vapad over there. So Pratibandhatmak Chikitsa you can use. So Charak Chakrapani Tika, Charak Sutrasthan Adhyay 28 and Shlok number 7. It mentioned some type of quotes, and you just go through. I have less time, so I just give some references for the treatment. You can go there and see the shlok, and their particular medicines are and the Chikitsa Sutra are there. If patient having a tuberculosis or any type of Rajakshama, so this type of condition, we can use some type of Kafagna Dravya, or we just patient having a sputum positive as per WHO regimen, but patient is only diagnosis with Rajakshama, and again have rarely on Santarpana Chikitsa, my dear friends. So it's suppose any type of Rakta Pradoshaj Vyadhi or mucocutaneous infection is there. So Charak Sutra Sthan, Adhyay 24, Shlok number 22, you just refer. Nati Ushna, Nati Shita, Lagu Dipanartha, dash dash. I just quoted Shlok only there. So there are mentioned Santarpan Chikitsa, then Sanshamana Chikitsa and Sanshodhana Chikitsa, means Shodhana Chikitsa. There is a no doubt fact AIDS is a apatarpan janyar vyadhi, my dear friend. So you just go through Charak Sutra Adhyay 23. It is very, all the quotes are mentioned over there. While describing indication of Brahan Upakram along with the Charaka has quoted Krisha and person including in different sex practices also. So my dear friend, Charak Sutra Sthan, Adhyay 22, Shlok number 26 is also important for this type of treatment to nourish the body and dhatus immediately. To nourish the dhatus slowly and steadily. Indication for first opinion, the person who has become carried in very less time, my dear friends. So the Santarpan is done very slowly in a person who has lost dhatus over a long period of time. So it include some gruta over there. You can use some type of gruta which mentioned in a Charak Sanhita, Charak Sutra Sthan 22, Shlok number 23. And you just go through Shushrut Uttar Tantra, Adhyay 41. It is also important. So as it case, there is Ojakshaya, which is the ultimate essence of all dhatus. So again, Santarpan Chikitsa helps to engaging the dhatus, and it is following as per to resume their quality of dhatus, to resume quality of quantity of dhatus, to resume the activity and ability of dhatus, or a person the functioning properly. After that, Sanshodhana means already I told you regarding a Panchakarma. AIDS patient having a Madhya Bala and suffering from a fever, vomiting, diarrhea, constipation, they are considered all the same entities. So Shushrut Sutra Sthan, Adhyay 15, Shlok number 22, it mentioned all type of things. Charak Chikitsa, Adhyay 1, Shlok number 7, Charak Chikitsa, Adhyay 2, Shlok number 8, mentioned while planning the management of AIDS, immune system correlate as well as immunoprotective drugs have through this point should be kept in mind, my dear friend. So during which you are using should be easily available of the patients. So quality of health, Sattva-vajay Chikitsa or Sattva Bala, this is the treatment of mana, prohibiting to including the efforts known as Sattva-vajay Chikitsa, my dear friend. So patient about a sex, he should be taught principles of Achara Rasayan and Sadvritta. He should know the severity of disease and prognosis. rehabilitation also mentioned Charak Sutrasthan Adhyay 15, along with internal administration of medical medicines, external application of equal important. So patient should be massaged with the different types of oil. Then medicine we can use. Also for AIDS patient, isolation and hospitalization is must. So separate hospitalization come rehabilitation centers must be the one of the part of this particular rehabilitation center. Also, for the preference or perfect rehabilitation of Ayurveda described, my dear friend, we are Ayurveda people. So in Ayurveda preferred Sadvritta, Sadachara, Dinacharya, Rutucharya, Ahar Vidhi Visheshayatan, various Divya Daiva Vyapashray Chikitsa, Satvavajay Chikitsa, as well as Yama, Niyama, Asana, Pranayama, Dhyana, Dharana, then Samadhi, then any type of Gita, then Mano Anukula Chikitsa. So we can treat these type of disease or these type of conditions with these type of line of management of the treatment. So at the end of my presentation, I again thank you, Dr. Shilpa Yerme ma'am and the team Ayush Darpan, who invited me on the occasion of World AIDS Day. Thank you all the students who are present, all the staff in the field of Ayurveda, all the practitioners. Thank you very much. Namaste. Thank you. It's up to you, Shilpa ma'am.
Yes sir, please. हो गया आपका? Okay, thank you very much sir. Thank you very much. कोई क्वेश्चन किसी का? Any question? If any question, doctors? Dr. Mandakini, Dr. Anjali, Dr. Mandeep sir, any questions from your side? Sir, one question from my side. Is there any particular plan for female patients or during pregnancy if any patient confirms about the positive HIV positive? So what will be the role of Ayurveda and how we plan for the better option?
At the end of my slide or end of my presentation, I mentioned Sadvritta, Sadachara, Dinacharya, Rutucharya, Ahar Vidhi Visheshayatan, and various Deva Vyapashray Chikitsa, Sattva. These are type of our Ayurvedic khazana, right? So we can use these type of medicine or these type of particular procedures in Ayurveda. We use some type of medicine as per our knowledge.
Yeah, definitely. What would be the better choice of Rasayana?
Madam, there are mentioned some Agastya Haritaki is one of the best medicine. Agastya Haritaki. Narsimha Rasayan also best medicine. But all the Rasayan treatment, it depends. Patient's bala, age, sex, depends on that. You are the master, so you just decide their bala situation and you can use.
Yes, sir. Nowadays, I think there are better options for HIV, so no need to worry. and it is not fatal too, because the earlier government and other all WHO and other
NGOs are very
higher
helpful
authorities,
for these
yeah.
type of patients, and many patients have not afraid if accidentally they become a positive, some doctors or some social workers, so need not to worry. They just follow the rules. They just follow the prevention is better.
यस सर, बिल्कुल। अभी तो गवर्नमेंट और बाकी सारे जो भी अथॉरिटीज है बहुत अच्छे से इसको प्लान आउट कर रही है। और आजकल ऐसे देखा जा रहा है कि इतने लोग भी डरते नहीं। पहले 20 साल पहले एड्स का नाम सुनते थे तो बहुत ही ज्यादा डर रहता था, बट अभी जैसे कि बेटर लाइफ और सारे डाइट और इसको अगर हम लोग अच्छे से फॉलो करते हैं, तो मैंने कई सारे रुग्णों को भी देखा है कि जो अच्छे से अपनी जिंदगी बिता रहे हैं, उनका वेट गेन भी है और दे आर हेल्दी, बहुत अच्छे से हेल्थ उनकी मेंटेन है। सो अभी इतनी चिंता की कोई बात नहीं। वी आर हैविंग बेटर ऑप्शंस विद आयुर्वेदा टू एंड मॉडर्न थेरेपीज आर अवेलेबल टू। सो इस प्रकार से आज के सत्र में हमने डॉक्टर भैरव कुलकर्णी सर से एड्स को लेकर जानकारी दी सर ने, तो मैं बहुत बहुत आभार व्यक्त करती हूँ। बट यहाँ पे हमारे साथ सीनियर डॉक्टर विजय जादव सर भी है, तो डॉक्टर जादव सर से मैं रिक्वेस्ट करती हूँ फॉर्मली वो एक वोट ऑफ थैंक्स यहाँ पे प्रस्तुत करें।
अंजली उठतीच नाही, जरा पटकन बोलायचं, कोणाला बोलायचं ऑनलाईन।
यस डॉक्टर जादव सर, अगर आप कुछ अपना यहाँ पे 2 मिनट। यस
हेलो।
हाँ सर,
Hello.
यस
Yes,
यू
sir,
आर
please,
ऑडिबल।
please,
Yes,
please, sir, you are audible.
Yeah, I am audible.
Yes, sir. Respected sir,
Firstly,
you are audible.
congratulations to you, Dr. Bhairav Kulkarni, and congratulations to Dr. Shilpa Erime, madam. As you said in the concluding part of your speech, that really, people are becoming aware. But when this epidemic came in the beginning, it was a horror. It was a horror like more you have
माइक म्यूट होतं। येस येस, माइक म्यूट होतं तुमचा।
so if we take all the which are our
बहुतेक इंटरनेट का इश्यू असेल तर आता हा आता ठीक आहे सर, आता काहीच नका करू। हाँ सर,
today was a very important day, World Day. So one congratulations to Ayush Darpan. Thank you very much.
Thank
Yes.
you, sir. Your remarks. Thank you.
Any question, Dr. Nishant or any doctor? If you want to ask directly, you can ask to Dr. Kulkarni sir. Yeah, as he is from medicine Chikinsa department, so he could answer better for your questions. I hope there are no more questions. So thank you, sir. Thank you very much for your talk, and all the best for your future, and all the best for tomorrow's your presentation. It's really a pride for us. So congratulations. Thank you very much.
Namaste. Thank you.
Namaste. Namaste. So I'm ending the session. Thank you.
Thank you.